Hi guys, and welcome to the final talk for the Soft Tissue Therapy Congress. This is the last interview that we'll be doing before the Congress, which is on Sunday the 21st of October, and enrolments close on Friday the 12th of October. And I make a point of that because the keen eye of the last video will know that I said Friday the 14th of October. So if you enter the competition and you pick that out, you'll probably already know by this point that you've won, so I'll try not to make a mistake this time. Last but no means least, we're joined by Rob Granter. Rob, thank you very much for being here today.
Thank you, Steve.
Rob, what can I say? Rob's a legend in the industry, and he's been an institution really here with MIMT, really shaped the courses that we offer here. And if you've done the diploma and the advanced diploma, you'll have had the pleasure of being taught by Rob. Rob's been in the industry for 33 years plus now, and has also been an educator as well. And Rob actually spoke at our very first conference that we did in 2013 and then followed up in 2014. So gone missing for 4 years, but glad to have him back for this one here. Rob also is a co-contributor to the book Clinical Sports Medicine, and most of you should have that. If not, why not? It is the Bible for the industry, and written by Bruckner and Kahn. It's the book that we actually now give to our advanced diploma students, and Rob is a co-contributor of that. Rob, I'm sure I've sold you short there and a number of things. For guys, I suppose, who haven't met you before, why don't you tell us a bit about, I suppose, your background and the experience that you have within the industry?
Yeah, thanks, Steve. I started, as Steve said, 33 years ago, but prior to that I was a social worker and working largely in youth work, and then I thought I could change the world more so by these hands rather than what I was doing with social work, so I decided to change careers. And it's been a great change of careers. So been working here at MIMT since 2004. So and my career spanned with a lot of largely in sports medicine clinics, and also travelling with teams to Olympics, to Commonwealth Games, and to various meetings around Australia as well. So quite a varied span of things, in my career. Fantastic,
and look, that's that experience has really fed through to a lot of our students, and the guys have had the pleasure really rave about the experience. So we're glad to have you on board again this year. Brings us on to your title of the talk, and you win by far the longest title of the conference. But again, that title tells us everything that we need to know, and I'm going to read it from here because I couldn't remember off the top of my head, so apologies for that. It's key factors in deloading stress on the supraspinatus, controversy, conclusions and collaborations. And I see the word controversy and that gets me really interested. So why don't you tell us a little bit more about what we can expect from that?
Yeah, thanks, Steve. It's one of those areas that it's very a personal favourite of mine, I guess, because I've had surgery in both my supraspinatus. I know a little bit about rehabilitation and the process, and I've always been interested in following research in relation to what's best practice in supraspinatus management. But there's also a number of controversies as well, so we thought we'd talk about those, and there's lots of them, even with the fact of even the name of the pathology, subacromial impingement syndrome. There's certainly controversy around the concept of impingement and blaming, perhaps, or over blaming the acromion in that whole pathology. So there's some interesting discussion to have in relation to even the name. There's controversies in relation to the role of surgery. How soon should we wait before if we eventually do go to surgery? And how does surgery stack up? There's been some really interesting research that's been delivered more recently, and just see how surgery stacks up long term against rehabilitation without any involvement. So we'll talk about that as well. We'll talk about lots of things, the role of soft tissue therapy in deloading supraspinatus. Does postural assessment have a role? They're all controversies. Is the role of optimising the posture and the movement of the scapular girdle, is that beneficial? There's these controversies that it's nice for us to mention. In terms of conclusions, we'll talk about some of the research that's on offer as well, but some of the soft tissue techniques that we'll go through, there's no research that underpins some of that work, except to the idea that if we work on something, Steve,
Yeah.
we reassess you afterwards, we're making positive contributions to lessening your pain and improving your movement, then we're working on the right pathway. So it's been a tradition of the Congress to have a reasonable component of practical demonstrations, and so we'll get onto that fairly quickly, and I'll talk about not so much, fancy things, but just bread and butter things that we would do as therapists that can really make significant differences to somebody who has pain in their supraspinatus, and how we can deload that. And collaborations, it's a perfect area of the body to work with other practitioners, introducing ourselves to exercise physiologists and other people involved in rehabilitation that we can work closely with, and so we will talk about some of the exercises, but exercise for this condition might be a whole talk in itself. So,
right, okay.
So therefore we'll talk about who can we involve as well to collaborate with to get a good outcome.
Fantastic. So I suppose you mentioned some of the techniques and assessments that you'll be doing. I suppose for a lot of the guys it will also be a reintroduction or a refresher for some of the things that they probably learnt and may have forgot that was a really important part for that technique as well. So that will be obviously covered throughout that.
Yeah, as well. Very, very much so. Yeah, it won't be highfalutin. It'll be pretty much very practical ideas, the way I would work, rather than in something that's too obscure, something that we can take away. Hopefully we can take some information that's important information from the research about what's beneficial, what's not, and processes we can put in place ourselves that can make sure that we're on the right track when we are treating people with shoulder dysfunction.
That's right. And look, I have got lots more questions, but I'm actually going to stop there and ask you more, because there's enough there for you to go on with, and if you want to know more, you need to enrol.
Yes.
So this is just a taster for you. So Rob, thanks very much for that. It does sound intriguing. The Soft Tissue Congress, as I said right at the top, it is Sunday the 21st of October. 5 presenters of all great standing. Thank you, Rob, lovely assistant. And it's worth being there. So the cut-off date is Friday the 12th of October, and it's a full day. And if you want to enrol, mimt.edu.au or call 1300 839 839. Rob, thanks very much again for your time.
Thank you, Steve.
Guys, we do hope to see you there. Thank you for watching.